This presentation was prepared as part of the HAP 709 course on healthcare databases taught by Professor Farrokh Alemi at George Mason University, Department of Health Administration and Policy. The slides are created and narrated by ChristinaLe, a student in the health informatics field graduating in 2020. What is normalization? Normalization is a technique of organizing the database into tables and columns in order to eliminate redundant non-key data and to ensure that each table has only columns that depend on a primary key. When data is normalized, we minimize duplicate data. We run into less issues when we try to modify the data through insertion, deletion, and updating, and queries become much more simpler to perform. Thus, what happens is an improvement in the integrity of the data, as well as the database system becoming faster, efficient, and accurate. There are 4 normal forms used in database normalization and are as follows: first normal form, second normal form, third normal form, and voice code normal form, or BCNF for short. But I will be discussing the first 3 as these forms are considered to be the main and only important normalization forms to be used. In the first normal form, each table should contain atomic values, meaning that a single cell contains only one value and that there are no repeating groups. Each record is to be unique. Here we have a table with patient information. We have 3 columns starting with patient ID, then name, and then diagnosis. Each column here should have one value and no repeating groups. However, looking at the table, we see here that under the diagnosis column, patient ID 46827 has 2 values, breaking the rule that in order for a table to be in first normal form, the column must have only one value. Therefore, this part of the table is not allowed in order for the table to be in first normal form. What must happen is that the table must be split to allow a diagnosis to coincide with that patient ID on another line. This is similar to what we see in the data that we were given for the class. As you can see here, the patient with ID 59557 has multiple ICD-9 codes or a diagnosis, and each is on a separate row. Once the data is in first normal form, it is then considered to be in second normal form, given that the first rule is true, and it must also have its non-key columns be dependent on the primary key. A primary key uniquely identifies each row in a table. Ask yourself this question: does the column describe what the primary key identifies? If the answer is yes, then the column is dependent on the primary key and belongs to the table. But if the answer is no, then the column should be moved to a different table. This enables the table to have a single common purpose and will easily enable us to find a particular value. Here is an example. Given the data table that we have been working with in this course, the primary key here is ID. Each column after that, ICD-9 and age at DX, all have to do with the primary key ID. They all describe the ID. The table is then said to be in third normal form once it is in second normal form, and there is no transitive functional dependency, meaning that there is no indirect relationship between 3 or more values in a table, or that a non-key field is not dependent on another non-key field. What this dependency does is contribute to data anomalies and inconsistencies. Once this dependency is removed, the amount of data duplication is gone as well. Let's take the following for example. This table shows patient ID, name, diagnosis, hospital, and hospital address. Given the patient's name, one can find what hospital the patient attended as well as the hospital address, and thus, if one were to look up the hospital, one can find the patient's name and then the patient ID. This type of connection is known as transitive dependency, and in order to have the table adhere to third normal form rules, the table needs to be split. Here, the table is split to follow the correct guidelines for third normal form. So given what we have learned about normalization, let's go through our assignment and answer these questions. In the question presented here as part of our assignment, a table is said to be in first normal form if all the fields consist of atomic data. B is incorrect because there should be no repeated rows. In this question, a good database design requires that a primary key should uniquely identify the individual occurrences of the entity or relationship. The other two answers do not adhere to any of the rules of normalization because the sequence does not matter to be a good database design. And non-key fields should be about the primary key, not the foreign key. Looking more into our assignment, if knowing physician name is enough for knowing physician ID, then which of the following statements is true? C is true because given the statement, if you were to look up physician name, then you can find the physician ID. Thus, physician ID is functionally dependent on physician name. In this question, if the field employee name is fully functionally dependent on the field employee name, then which of the following statements is not correct? We want to find what is not true here. Because employee name is dependent on employee number, you can only find out employee name if we are given the employee number but not the other way around. In this next question, when we talk about tables being in second normal form, we can say that the primary key is the minimum subset necessary to determine each fact in the table. A is incorrect because a foreign key and a primary key are two different variables. And choice C is not true as the last two fields do not always depend on a concatenated primary key, which is a combination of two or more column values used to define a key in a table. And given what we learned about normalization, the answer to this question about which of the following are good rules of design for normalization is that the primary key should uniquely identify the entity. A and B are incorrect as normalization denies any repeating fields or multiple entities. The last question in our assignment states that a good database designer might not put the field visit date in the patient table because the date fields are never put in a patient table because date fields do not relate to defining the patient. In summary, normalization is progressive, which means that in order to get to third normal form, the data must be in second normal form. And in order to be in second normal form, the data must be in first normal form. Remember that each column must have one value, and each value must relate back to the primary key, and that there can be no transitive functional dependency among the non-key values. Once the data is normalized, queries become simpler to handle, and database systems become more accurate, faster, and efficient. This concludes my presentation on normalization. I hope you enjoyed it.